across California on our Health Beat. Open enrollment for Covered California ends today. The deadline comes on the heels of Governor Newsom's announcing sweeping proposals, including a new mandate and expanded subsidies. Here for more on what the governor's plan means and how it might affect all Californians is John Baackes, CEO of LA Care Health Plan, the largest public health plan in the U.S., serving 2 million residents here in LA County. That was a long introduction, but welcome. We're happy to have you here.
My pleasure.
Good, thank you. So let's start out with a clear understanding of what the LA Health Care Plan is and does, and the difference it is from the Covered California.
Sure. LA Care Health Plan has been around for 21 years, and we serve Medi-Cal beneficiaries. So in Los Angeles County, if you're on Medi-Cal, you have to enroll in LA Care, and then there's a plan called HealthNet. You have a choice, and you have to enroll in one of them. That's how you get your Medi-Cal benefits. Covered California is a voluntary program set up under the Affordable Care Act for people who don't qualify for Medi-Cal, meaning their income is over 138% of the federal poverty level, and they are not eligible for insurance at work. They can go on the exchange and buy individual policies. And there are about 1.3 million people in California who have chosen Covered California. LA Care participates. We have 70,000 people going into this open enrollment. We have, as of last night, signed up over 20,000 new people to the program. So there's still interest in this.
But today's the last day?
But today's the last day until next year.
So what do they need to do?
They need to get online at coveredcalifornia.com and look at the options they have, and they'll wind up picking LA Care.
So Governor Newsom has come out with all these new plans regarding health care, including our own individual mandate. Can you explain what that is and why it's good or bad?
In the original Affordable Care Act, one of the provisions was an individual mandate, which said you must demonstrate you have insurance. Either you're on Medicare, Medicaid, in the military, or you get it from your employer. And if you didn't, then you had to pay a penalty or a tax. Congress removed the tax with the tax bill they passed at the end of 2017, so that beginning this year, 2019, there's no more tax.
But the math doesn't work if there's not an individual mandate, correct? Because if you don't have an individual mandate, healthy people won't sign up. They're going to just say, I'll roll the dice, I'll take my chances, and therefore only sick people sign up, and therefore costs are out.
Costs go up.
Right.
So we were delighted that the governor is proposing to restore the mandate and, well, the mandate
and
of California.
And subsidies, too, for those who can't afford it.
And putting the penalty back in, and he's proposing mimicking exactly what the federal mandate was.
And is that going to lower the insurance costs?
Yes, because it will bring, as you pointed out, younger, healthier people into the mix, which lowers the risk of the pool and makes it less expensive. We're socializing the cost of medical care when we try to include more people in it, and that's been the foundation of insurance from the very beginning.
Forever. You know, this is another case, though, of California just saying, well, the federal government will do what the federal government's going to do, but here are our values, and we're going to put our money where our mouth is. Is that the right approach all the way around for the governor?
I think it's the right approach for California, and certainly the governor proposing this, I think, is wonderful. We're very pleased. The governor also has proposed adding another layer of subsidy. The Affordable Care Act and the individual exchanges work, A, because of the mandate, but B, because they provide a subsidy sliding scale based on your income. To get to Medi-Cal, 138% of federal poverty level. After that, up to 400%, you get a subsidy if you enroll through Covered California. The governor has proposed raising the subsidies to 600% of the federal poverty level, with the state funding those subsidies directly. We applaud that as well, because we're finding that many people, the biggest cohort of people in our program at LA Care through Covered California are 50 to 59-year-olds. That says to us there's a whole cohort of people
Super young people is what you're saying, in other words.
Really young. These are people who may have retired early or cannot work any longer because of a health issue, and they need insurance, and they're going to buy it, and the subsidy makes it very important for them. So that if we expand the subsidy and get more people in the pool, it works out all around.
Oh, and hopefully that prescription drug plan that he hopes to lower by collective bargaining will work too.
Well, the prescription drug plan is only aimed at Medi-Cal, and what he's proposing is that they claw that back from us, and we no longer provide it, but the state will do bulk purchasing, and they'll provide the benefit. That remains to be seen how that's going to work, and we're applauding the idea that we're going to look at it, but we also want to see the details.
Where can
And give
people
us that
find
website
you?
again.
Last day to sign up. Go to
CoveredCalifornia.com.
CoveredCA.com.
Yeah,
Okay.
and it's all there.
Thank you so much for coming
My
in and
pleasure.
explaining it. It's always so dense, isn't it, once you start talking
It's
about
dense, and you did a really good job just humanizing it and breaking it down.
breaking it down.
Thank you very much.
We like things simple.